I'm Dr. Bill Paul. I'm Director of the Metro Public Health Department here in Nashville, and I want to welcome you to our brand new public health headquarters. Our mission here, what really brings us to work every day, is to protect, improve, and sustain health and well-being for everyone in Nashville. Having health insurance is a key ingredient of health and well-being and peace of mind for most of us. And we also know that lives can be saved when people without insurance are able to get coverage. We also know that to succeed in our mission, or to succeed in helping people sign up for affordable care, we cannot work alone. We need to work with partners, and you see that in Nashville with the many organizations and individuals who've come together to help people sign up for coverage under the Affordable Care Act. We've been able to offer some space and support for volunteers who are right now part of a citywide effort we call Get Covered Nashville and Get Covered Tennessee. It's now my pleasure, my privilege to introduce Mayor Karl Dean. I'm sure many of you already know that Mayor Dean is interested in our health. He has invested a great deal of time and energy into moving our city towards a culture of health. He's challenged and led us with campaigns to walk 100 miles with the mayor and also to join him in training for 5K. He's also invested in parks, greenways, and sidewalks all over Nashville, and he's focused consistently on education and economic development. These are fundamental necessities for health and well-being for everybody in Nashville. Mayor Dean's made a difference. He's moved us towards a healthier place and being a healthier city. Please join me in welcoming Mayor Karl Dean.
Well, thank you, Dr. Paul, and thank you all for coming today. Secretary Perez, I want to echo Dr. Paul's remarks and just say it's an honor to have you here in Nashville. A great thing about being mayor, I can say welcome on behalf of all the people in Nashville. We're thrilled. And thank you for coming here to help us promote the Affordable Care Act. Last week we held a public event, and I stood in this very spot to let uninsured Nashvillians know that health insurance that they can afford is actually within reach. I see people here today who were here the last time I was here, and I see some new faces. This showing of interest and support just confirms for me that people in Nashville really understand how important it is that people know that affordable health insurance is within reach. When the local Affordable Care Act consortium asked me to come back today and basically do the same thing, I quickly agreed. I plan to participate in even more events as my schedule allows because this is important to the city. This is a big deal. We have thousands of uninsured people in Nashville and in the surrounding community. And I realize that the marketplace is not the answer for all of them, but I really do believe it is the answer for the majority. We need to do everything that we can to get the word out. We set a goal this year to double the number of people we enrolled last year, and I'm confident that we can reach it. I'm really big on us doing everything we can to live healthier lives. We need to take care of ourselves. We need to eat right. We need to stay active, but we also need access to doctors. We need access for preventive care. We need access in the event that we have an accident or some other health problem catches us by surprise. And that's what's so important about today. We have to keep talking about affordable insurance. Open enrollment round 2 kicked off Saturday. Get Covered Nashville tells me that our city got off to an excellent start, that several people got signed up, and that we are enjoying a steady flow of people visiting our enrollment sites. I want to let you know that our city is fully committed to this effort, and as I said, we've got a goal of doubling that number who signed up from last year. Our libraries served as enrollment sites last year, and they will serve again this year. Dr. Paul has provided space where people can enroll here at Lentz, a great new building that opened in July. As part of our outreach efforts, we encourage congregations, not-for-profits, and other civic and community groups to host awareness and enrollment events. Covered Nashville reports that they are getting an average of 12 calls a day from people wanting to host events. It's also great to have with us today Ward Allen. And Ward, it's good to see you here. When I was here before, I talked about you in your absence, and I talked about your experience. But my account is just my account, and folks want to hear from you. You're proof that the Affordable Care Act really does work for people even if they have a pre-existing condition, and you're proof that there is no such thing as being too sick to get coverage. You're proof that having insurance that you can afford really can be the difference between life and death. I can't really leave this podium without encouraging any uninsured citizen out there to consider the Affordable Care Act. Even if you think you're too sick, or even if you think you might not qualify, please check it out anyway. There are many people out there, there are many people here who are just waiting to help you. Thank you all for being here, and Secretary Perez, thank you for coming to Nashville today to highlight this important program.
Thank you, Mayor Dean. Now I'm very pleased to welcome and introduce Labor Secretary Thomas Perez to Nashville and to speak to us today. Secretary Perez understands the connections between human rights, economic opportunity, and public health, and how important it is for everyone to have access to health services. As a public health person, I was Googling you earlier today. And I especially want to note that Secretary Perez served in the Clinton administration in the HHS, Health and Human Services Office of Human Rights, and made sure that organizations like ours can communicate with our customers in languages that they can understand. So thank you for that. Also served on the faculty of the George Washington University School of Public Health, where he lectured on civil rights and did research on access to health care. I could go on, but I'm going to just, at this point, say, Secretary Perez, it's an honor to welcome you here to Nashville.
It's an honor to be here. Hey, good afternoon. It's an honor to be here. Mayor, thank you for hosting me, and Doctor, thank you for hosting me. And I should probably make an admission to you. I'm the youngest of 5, and all of my siblings are doctors. And I had to promise them that I'd never be a plaintiff's personal injury lawyer. And I did keep that promise. And my father was a doctor as well and worked at the VA hospital until he died in 1974. And so I sat around a lot of dinner table conversation on medicine, and I have profound respect for the profession and for what you do, which is expand access to opportunity and health security. And I want to thank so many of you here. How many work here for the department or are partners of the department? There we go. We got a lot of partners here. And I want to say thank you, because I know, having worked at HHS before and having been neck deep from the outset in ACA outreach, that we can't do it without our partners. We've had so many wonderful partners in local government. I remember going down to Texas a year ago and spending a lot of time with mayors down there. And I used to be a local elected official, and the rubber hits the road at local government. And so, Mayor, I'm very, very grateful for your dogged leadership on this and your recognition that this is not only a healthcare imperative, but an economic imperative, a security imperative, a moral imperative for the residents of Nashville, and a remarkable opportunity for the residents of Nashville. And so, again, I want to say thank you. And I look forward, this is always about the people. And I'm so inspired when I go around this country and I hear from people who have benefited. I'll never forget. And sometimes we lose sight of the fact that not simply the beneficiaries of the Affordable Care Act include, but are not limited to, the, was it 46,000 people or however many it was who enrolled a year ago. So many more people benefit from the Affordable Care Act. And I remember vividly, I was in Cleveland a year ago, and I met a little girl. And when I say little, I mean little. She was 1 pound when she was born, 1 pound. And as a result, she was a triplet. And as a result of the remarkable health care she received, she was 9 months old, and she was doing everything that you want a baby to do. She was healthy, she was smiling, she was getting ready to go home, and I was in Cleveland again a couple weeks ago, and I got an update, and she's doing great, and she's with her 2 siblings, and they're enjoying all the life you want. And I asked, so what's the what's the meter running? How much is the bill reached? $3 million was the answer. However, as a result of the ACA's ban on lifetime caps, their parents aren't facing bankruptcy as opposed to what would have happened. I talk to seniors all the time who say, thank God for the ACA, because I've been able to close that donut hole. And when you look at just the state of Tennessee, 95,000 Tennessee residents, Tennessee seniors in 2013 saved $77 million on their prescription drug benefits. That's real money for real people, and that's the Affordable Care Act. I have so many friends with pre-existing conditions, and they no longer are in job lock because of health insurance. You look at Tennessee residents, and they got something like $4 million in rebates in 2013 because under the Affordable Care Act, if insurance companies are spending too much on overhead, you get that rebate. So $4 million went directly into the pockets of Tennessee residents as a result of the Affordable Care Act. So we often think about enrollment, and that's the subject of our conversation, and there's a lot to talk about there. At the same time, there's so much more to talk about with the ACA. I've had the privilege of traveling the country and seeing the ACA at work, and it is indeed at work and working quite well, transforming lives. When I was on the plane on the way here, every day I get a set of a compilation of clips from newspapers from across the country, and I saw one from Tennessee today talking about a study from the University of Tennessee reporting that the number of uninsured residents in Tennessee has hit a 10-year low. That is a direct response and product of the Affordable Care Act, and that is something to be very proud of. And that is a direct response and product of the great work that people in this room have done in partnership. And as Dr. Paul and the mayor correctly said, we can't do it alone. We are only as good as our partners out there in the community. So faith leaders, other nonprofits, hospitals, other health providers out there, other elected officials who are out there doing great things. We are remarkably appreciative. And there's also been a lot of studies that have looked at the satisfaction levels of people who have enrolled in exchanges around the country. And when you look at that, there was a new Gallup poll showing that nearly 3/4 of people who bought policies through the exchanges last year rated their coverage as excellent or good. So how are we doing quality-wise? You see so many examples of folks who, for the first time in their life, in many cases, have care, and it's great care. And this is a health care epicenter of the United States, and you know the care that folks are getting here is second to none. We look at affordability, and nearly 7 in 10 people who picked a plan through the marketplace found coverage for less than $100 a month when you factor in the tax credits. That's remarkable. I wish my cell phone bill were less than $100 a month for my family and me. That would be really, really helpful if we could get that cell phone bill. So imagine being able to get health care for less than your cell phone bill. That's a pretty good deal. And that is why I'm so excited to be here, and that's why I've been so excited to travel around the country. And you saw Saturday was a good first day around the country. 100,000 people submitted applications across the country on the first day, and the website was able to handle the traffic. I apologize again for the glitches of last year. Those are in the rearview mirror. We're moving forward, and we're working diligently. We've made the process faster, simpler, and more intuitive. So if you're reapplying, we've made it as user-friendly as possible. There are many choices to choose from. There are linguistically competent. I appreciate your mention of the work I did at HHS to ensure that we are meeting people where they are. So si no habla inglés, puede comunicar en español con una persona que entiende la procesa excelente. And so if you don't speak English, you can speak to someone who speaks Spanish, or if you speak another language, we have that capacity as well. And so I hope people will visit healthcare.gov. I hope people will, if they don't have a website, will simply pick up a phone and call 800-318 2596, because we are going to work there, and we have folks that are ready, willing, and able to help. We were just upstairs getting a tour of your wonderful and green building, and I saw a couple people who were in the process of enrolling, and it always brings a smile to my face, because I can't imagine the angst. And I've lived a charmed life because I've never encountered uninsurance. And my family has never encountered uninsurance. It's simply second nature. If we have an issue, we can go to a doctor. And when I used to teach, I encountered so many people, and we helped so many people who weren't so fortunate. I had a young boy, 12 years old, who died of complications from a toothache, because he didn't have access to dental care, a toothache. An $80 extraction would have saved his life, but he's no longer with us. And $250,000 was spent in the last week of his life to try to keep him alive. That's preventable. That's unconscionable. That's not who we are as a nation. And that is why the Affordable Care Act is working. And when you have access to the remarkable resources of a healthcare system, affordable access at less than the cost, in many cases, of a cell phone bill, that's what self-sufficiency is all about. You made a lot of progress, and you reached something like 165% of your goal last year. And what I admire about you, Mayor and Doctor, is that you're not resting on your laurels. You're saying, you patted yourself on the back for a day and you said, good job, and then the next day you woke up and said, let's set a bar, and it's a high bar. And the only way we know we're going to meet that bar is everybody working together, everybody getting out there, getting that word out there. And it's a great word to get out there, because this is about making sure we have that building block of self-sufficiency. Without access to health insurance, that building block is not there, and life gets so dicey, and we don't want that. So thank you for having me. It's an honor to be here with all of you, and it is really a tribute to your doggedness and to your leadership that Nashville is a real model across this country of how the ACA is working for everybody. Thank you so much. And again, 800, keep those 800 numbers coming, keep that website coming, keep those navigators coming. And to all of you here and those of you who are watching at home, thank you so much. This is really so exciting to be here, and it is so remarkable, the work that you're doing. It really does take a village. And you have a remarkable village here that's going to help so many people get access to the health insurance that they need and the health care that they deserve. Thank you so much.
Thank you, Secretary Perez. Yes, it's a village. There's a lot of folks here that I recognize pitching in, playing a part, that we're part of a bigger fabric of better health in Nashville and a bigger fabric of getting people covered. I'd like to now welcome Sharon Barker. Ms. Barker is a navigator for Affordable Care Act.
Good afternoon. As he stated, my name is Sharon Barker, and I am a certified navigator with Family and Children's Service, and I have the distinct honor of getting up every morning and going out and helping people to connect with quality, affordable health care, giving them access to something that they may not have had access to a couple of years ago. And it is such a pleasure. It is almost like, I hate to say it's my job, because it's really not like a job. It is something that I so enjoy getting up to do. I can recall last year in OE1, and I met this young lady at the Starbucks, and she was a beautiful, young, vibrant 26-year-old. And when we met there, she had this look of horror on her face, because she says, well, I have to tell you something. And I said, yes, what is it? She says, well, I have cancer. And she did it like, I know you're not going to help me now. And I go, oh my gosh, it's okay. You have something for you. We have something. You're not going to be denied. And she was like, wow, we got started, we got her application in. Her parents were coming in that weekend, so she was kind of trying to get all of this done before they got here. And that made me feel so good, because even though she had, she was not on her parents' insurance anymore, which if she was 26, she could have been still on there. But she was able to say, you know what, I'm 26 years old, I can get my own insurance. Her parents probably would have mortgaged the home if they had to help her, but they didn't have to do that. And so this is the kind of thing that I get to do day in and day out. Connect people with hope, actually. Connecting people that have never, for sometimes never have had insurance. So I get to educate. I get to explain to them, what is this that you're getting into? How is it going to make your life better? And the light comes on, because so many times they are misinformed about what it is that they're getting into, or they've heard all kinds of horror stories about how it's going to work. And when we just sit down as navigators and explain to them the process, explain to them the plans, explain to them the premiums, it is like pouring water on a plant. They just come alive, and they feel like, oh my gosh, this is great, because they feel like they're doing something for themselves, and they're not taking government assistance. They're actually have private insurance. Their card will look just like my Blue Cross card, and they feel really good. And it's about a pride issue. And so when they know that, you know what, this is not government. No, this is not a government program. You have private insurance. And it's like they are so excited, because most people want to feel like they have control of their lives. They want to feel like they're doing something and not being a burden. And I've had people to tell me that. I don't want to be a burden on the system. Well, guess what? You're not. You're paying for this insurance. And we're so happy that you are, and that now you have access to it. And now that you can afford to do the things that you need to do. And the other person I helped this Saturday, I loved it, because her employer, she was her employer's only employee. And God bless her employer. She wanted to help her employee have insurance. So her employer would pay half of her premium, and this young lady would pay the other half. And since the Affordable Care Act came in, the employer said, okay, little birdie, you can fly. And she came in, and she sat down with me, and she was able to get a plan. So she feels good that now she doesn't feel like she's a burden on her employer, having to pay half of her premium anymore. And the employer feels like, okay, wow, I was able to pay that until she could afford it or have access to it. Now that she can have access to it, she can go. And both people are just extremely happy. So as a navigator, I also go and I help. Yesterday, I did a presentation for a medical facility to their staff, because they need to understand how the Affordable Care Act plays in with their staff, and how they can answer questions if a navigator is not around. So we had a lunch and learn, and we just ACA 101, and it was fabulous. And so they were appreciative, because a lot of times you think that the medical professionals and everybody are up on everything, and in fact, when you presented, they have questions too, and they're going, oh, I didn't know that. Oh, really? So as a navigator, I have the privilege of educating, I have the privilege of enrolling, and I just have the privilege of seeing really happy people. And just in leaving you, I'd like to say my daughter, who is a recent grad, and we were looking at, which way she wants to go and everything, and she's looking actually at a master's in public health, and I said, you know what, find something that you so enjoy doing that you would do it for free. That's what I'm doing. I love this work so much that I would do it for free. Yeah, Mike, I said I'd do it for free. And I mean, and I am not. But seriously, it gives me a joy. It really gives me a joy to know that I am a part of somebody having access to affordable, quality health care. And I just wanted to say thank you for the opportunity, Seedco, and thank you for the opportunity to just call myself a navigator. Thank you.
One of my favorite people.
Now, Ms. Barker, you can't go on the road with the secretary. We need you here.
I'll pay it.
Oh. Thank you so much. Please now welcome Mr. Ward Allen. Mr. Allen has a story to tell, and we really appreciate his being here.
Good afternoon, everyone.
Good afternoon.
I've learned two things already today. ACA, I didn't know that term. I knew it was affordable, but it was for me. And navigator, I didn't know that, but a navigator helped my wife and I get insurance. So thank you for what you do. And anybody that has trouble signing up needs to see a navigator, because it was simple according to my wife. I was too sick to know when we signed up. But I've written down a brief version of my story about actually from adulthood till now, and here we go. It's kind of going to spill the beans for Ward Allen, but here we go. I'm going to open by telling you that I would not be standing here today if it wasn't for the ACA. If it had not passed, I wouldn't be here. I've lived in Tennessee most of my life. I was born in McMinnville. Now I live in Perry County, Linden, Tennessee. In my early working career, 2 jobs were usually necessary to make ends meet. I never had insurance because they didn't offer it. And I could never afford health insurance when I was young. This is no excuse. There is no excuse for this now. Going without is just too risky. Like the Labor Secretary said, it can bankrupt you. It did bankrupt me with health issues early. Bankrupted me, and they weren't my issues, they were my family's. Around the age of 30, I began a career as an over-the-road truck driver. The first 3 years went very well. My 4th year, when I went for my physical and recertification of my DOT medical card, I failed to pass due to high sugar count. They checked my urine and sugar was way too high. At this time, I had great insurance due to a good job. I went to see a diabetes specialist. He eased my mind when he told me that type 2 diabetes was easy fix with pills, diet, and exercise. And thank you, Mayor Dean, for getting everybody to exercise. You've inspired me as well. The diabetes was under control within a few days, and I passed the physical. And as the years went by, I started feeling more and more tired. So I went to my primary doctor, and he said, let's do a test for hepatitis C. Guess what? I had it. He informed me of the 6 to 9 months treatment that was available at the time that may or may not cure your disease. He also told me that I would be too sick to handle my job during this treatment, so I made the worst decision of my life. I decided not to treat the hepatitis C and pretend I was healthy. This went on for another 16 years. The doctors kept watch on the hepatitis C. It was always there, but for the most part, I was physically okay. No signs of illness. I mean, I physically unloaded my tractor trailer, so I was healthy, or I felt healthy. About 20 years of driving, it became extremely difficult to do my job. I couldn't stay awake. My primary doctor said my sugar was out of control, put me on insulin, which disabled me from trucking. And it was a good thing, too, because the hepatitis C was too far along and cirrhosis, it had turned into cirrhosis of the liver. They said, no chance of treating your hepatitis C now. You should have done that 20 years ago. The gastroenterologist said it was a mild case of cirrhosis. He also said we need to keep a close watch on this. I met my wonderful wife, she's here today, and I moved to Texas with her. She had a fantastic health coverage as she was a traveling nurse with a dialysis traveling nurse. She got a job in Texas that was stable, and we stayed there. The insurance covered me, even though I had all these pre-existing conditions, diabetes and cirrhosis. After about a year in Texas, I was on the fast track to receive a liver at the Texas Transplant Institute. A few weeks before getting on a list for a liver transplant, my wife came down with pancreatitis. It became chronic and she was disabled. Her work dropped the insurance. We wanted to keep the coverage through COBRA, but decided we couldn't afford the premium. It was way out of our means. Second worst decision I ever made. Due to no insurance, I wasn't qualified to stay in the transplant program. So we then moved back to Tennessee to be closer to my children because I thought I was dying. I was dying. At this time, we were uninsurable. We made just barely enough money that we could not qualify for Medicaid. And due to all of our pre-existing conditions, no insurance company would take us for any amount of money. 4 months later, around Thanksgiving last year, with no insurance, the worst happened. The cirrhosis started attacking my liver with a vengeance. Fluid gathered until I looked pregnant. My feet and legs were grossly swollen, and my muscles were deteriorating. I remember being very weak. The doctors told me that they looked me in the eye, and it's the first time anybody had looked me in the eye and said, "You're going to die if you don't get a liver transplant soon." This was last December with no insurance. The good people at Vanderbilt helped me by, they took the liver off of me. They treated the fluid retention with diuretics. It got where I couldn't urinate. I couldn't go number 2. I was in the hospital clinging to life. My brain shut down at least 3 of my 5 hospitalizations. They drained gallons of fluid off several times. While all this was happening, my wife was dealing with a lot of pain and her pancreatitis. She was trying to sign us up on the marketplace with the internet with no luck. Somebody finally said to see a navigator, and thank God for the navigator. She had tried a few times with no luck, but the navigator in Perry County, Janet Carroll with the Perry County Medical Center, helped her with the application. She said it was only less than an hour it took. I don't remember how long. I was too sick to know. But we qualified for a $900 subsidy. And since the only income because of the only income we had was at the time was about $2,000 a month, I can truly say that the Affordable Health Care Act saved my life because pre-existing conditions don't matter anymore. And we could afford the premium. Our premium was only $109. The policy took effect on March the 1st. Vanderbilt found a donor and transplanted his liver into me on March the 13th. Unheard of. After they were sure of no rejection, about 6 months later, they gave me the new 2-pill-a-day treatment for hepatitis C. It only lasts 12 weeks. Anyone that has hepatitis C has no reason not to do it. I had no side effects at all. And now, 3 months out, I'm hepatitis C free. I have a chance at a new life. I'm getting ready to go now and try to pass a physical where I can go back to work. Thank you very much.